tough. I think the game has changed a lot. You know, I think it'd be easy to sit here and blame the pitch clock. You know, I think in reality, you put everything together, and everything has a little bit of influence. You know, I think the biggest thing is the style of pitching has changed so much. You know, everybody's throwing as hard as they possibly can, and spinning the ball as hard as they possibly can. And you know, it's hard to deny those results. Obviously, how can you? It's a double-edged sword. How can you tell somebody to go out there and not do that when they're capable of throwing 100? And you know, this young guy comes up and throws a pitch 95 and gives up a big homer, and everybody's like, "What the hell, man?" So something needs to change.
That is was the pitcher's eye view. I guess it still is the pitcher's eye view of the rash of pitching injuries in Major League Baseball. That is Justin Verlander from April the 7th. And, you know, you look at the names: Shane Bieber, Spencer Strider, Framber Valdez, Garrett Cole. You know, not all of them having Tommy John surgery, but a lot of them shut down with elbow issues. Guys like Shohei Ohtani, Sandy Alcantara, Jacob deGrom, and Shane McClanahan. Those are just some of the top pitchers in the game who had Tommy John surgery, or reconstructive surgery, I should say, last year as well. And it's odd because those are big names, and we just rush out and say there's a pitching crisis, there's a pitching crisis. But if you look at the raw numbers, and folks like, you know, the scorer, Travis Sawchuk, and other people have done studies in this. In terms of the raw numbers at the major league level, it's actually kind of on par compared to last year and the year before and the year before that. But look, there's no doubt that over the years, the number of Tommy John surgeries has increased dramatically. Dr. James Andrews, a longtime orthopedic specialist. I was only half joking when I said a little earlier that if your favorite pitcher underwent Tommy John surgery, there's a pretty good chance that Dr. James Andrews did it. We're very pleased that he joins us on Blair and Barker. Dr. Andrews, thank you so much for doing this. It's a pleasure to talk to you. Look, how much of the focus we're seeing right now on elbow injuries is due to the fact that there are more elbow injuries, or is it due to the fact that with all the controversy and the focus around the pitch clock, it's like people are looking for an excuse here to almost turn this into a political thing?
You know, I can't say anything about the pitch clock because I think everybody's sort of gotten beyond that. It's much deeper relative to the root cause of the elbow and the shoulder injuries than that. By the way, I was just looking up some of the statistics to tell you how critical this is. For example, of all the Major League Baseball pitchers that started spring training this year, 35% of them had already had a Tommy John's procedure. And for me, and I'll just preface my remarks real quick, the culprits are one of three things, basically. And the pitch clock is not one of them. Number one is too much velocity. Number two is too many pitches. And then if you add poor mechanics to those two things, then you've got a disaster. That's basically, from a sports medicine standpoint, how I see it.
You know, before we focus on the injuries at the major league level, one of the things it seems to me, again, from a distance, is that there's kind of two tracks here. There's pro pitchers who have elbow issues, but or shoulder issues, something you've talked about a lot and something you've been very active in. It's also the high school kids that are going through this. Is there a one-size-fits-all approach to, I'm going to use the word curing this, Dr. Andrews?
Well, you make a very good point, and I would add to that to say that the risk of pitching injuries in professional baseball is also related to the epidemic of injuries associated with the shoulder and elbow in youth baseball. If you look at and closely get a when you have a major league pitcher come in to see you with, say, an elbow or a shoulder problem, if you take a real good history, sometimes they've forgotten about when they first started having trouble. But anywhere in my practice, statistically, anywhere from 50 to 60% of the major league pitchers that are having trouble, once you go in depth with them, sometimes you have to ask their mother what happened to them when they were 12 or 13 years of age. And about 50 to 60% of them will then relate to an injury they had when they missed 2 or 3 weeks or 4 weeks or 6 weeks when they were young in youth baseball. And so the problem with coming out of high school is most of them nowadays are coming out of high school already being injured, and a lot of them have already had a high school Tommy John's procedure. So there's your real root cause is what's happening in youth baseball with showcases, multiple leagues, too many innings, trying to match a radar gun when you're 15 years old at 90 miles per hour. Again, too much velocity. By the way, parents will spend umpteen jillions worth of dollars on their young baseball players to increase their velocity by certain situations that they pay for to be able to throw 90 miles per hour. The word amongst all these parents is if you can't throw 90 miles per hour when you're in high school, you have no chance of playing up the ladder either for the college scholarship or getting drafted or to play professional baseball. So your real root problem begins in the youth leagues, and that's what I've been so passionate about since year 2000 when I started seeing the epidemic rise of injuries in youth baseball and youth sports in general, not just baseball. Baseball is the star of that particular problem, though.
Doc, you can understand with a young person wanting to figure out how to throw hard, how to spin it, because, you're trying to make money. That's just the way baseball is nowadays. If you had to give advice to a professional baseball player that you've worked on, is there something you would tell them? Would it be lift more weights with your lower half? Would it be throw more bullpens? Would it be long toss more? Your chances of lasting longer and not seeing me again would be better off doing what?
Tried to learn how to throw strikes. Go back to what Hank Aaron taught us all when he was the director of the minor league organization for the Atlanta Braves. And he brought along those pitchers that you remember that were so good because they knew how to throw strikes and they knew how to place the baseball and they knew how to change their velocities up. And they did not try to throw as hard as they could throw on every throw. So with kids in high school and younger, number one, I try to tell them to stay away from showcases and outlaw. I've said for how many years now, 20, that the radar gun should be outlawed in high school and younger age groups in baseball and youth baseball. It's done nothing but create all these problems for us. The dads all have their own radar gun now. And the first thing a kid will tell you when he comes in with an injury is how hard they can throw. They have no idea when they tell me that's the root cause for their problem. And they're completely unashamed of it. And the parents are bragging about how hard they can throw, and yet they're in there with the Tommy John's injury.
I read.
Let me tell you
go ahead.
a little something else that might cap off what I'm saying. Dr. Fleisting, who's the head of our biomechanics baseball lab here in Birmingham, we did a study on the tensile properties associated with the Tommy John's ligament. And we found out that the red line for that ligament, meaning where it would begin to break when you're in high school, it will begin to redline at about 80 miles per hour.
Wow.
It nears its peak at 85 miles per hour. And at 90 miles per hour, it can go anytime. It can go with fatigue, with the too many pitches, too many innings, et cetera. The only way you get away with it at 90 miles per hour in high school is from a genetic situation. And that means their daddy was a major league pitcher and they were born with a ligament that's already more developed. By the way, baseball is a developmental sport. That's the thing that we all forget about. developmental sport means that you get better at it all the way up to a certain age. And the ligament gets stronger during that development. So you have to pitch to develop it, but it gets stronger up to about age 26. It's certainly not ready to throw 90 miles per hour in high school. That's why all these high school kids are getting hurt.
You know, hearing you talk, I was lucky enough to cover Pedro Martinez when he was with the Montreal Expos, and you know, Pedro always used to say, we used to talk to him about his pitch. He said, "Well, I'm from the Dominican Republic. All I do is I throw, I throw, I throw, I throw." Is that just something? And you hear that from a lot of pitchers from Caribbean countries, right?
Absolutely.
Guys we talked to. Hey, I just throw. But yet you're talking about workload and innings as being an issue. Is there a difference between throwing and pitching in a competitive game?
Oh, there's always a difference. When we step people up following an injury, and we start them off with what we call active rest, where they're just doing exercises, getting their motion and soreness out, and then we start them throwing short distances, and we bring them out gradually, step by step. And let's say they've thrown simulated games, they've thrown batting practice, simulated games, and even if they've done that and you move them into a competitive mode, that's a different level. They throw at a different level of more intensity when they're actually playing competitively than what you could ever get them to do with getting them ready in a simulated game. So there's always that step when you first come back competitively, and you have to really pitch count them because it's a different level of stress.
Doc, is there a difference between a split finger, a curveball, a changeup when it comes to stress on any part of your arm that maybe if you don't throw one of those three pitches as much, you may have a chance of lasting longer without seeing you?
Well, the whole answer to your question, regardless of what pitch they're throwing, is the mechanics. And, you know, we have some studies that we did with Glenn Fleising about the curveball in youth leagues. And we found out if they throw a curveball at a young age, which, you know, we always say you shouldn't, even now we say they shouldn't throw until they have shaved, which means they've reached skeletal maturity. But if you throw it even at a younger age with good mechanics, it's no difference stress on your elbow or shoulder as compared to throwing a fastball. Now, it's always been known that throwing a changeup was a relief pitch. It allowed your arm to have a little bit of a rest, and also tricked the batter, particularly in the youth leagues, to swing at something that was coming at a different speed than a fastball. The problem we're seeing now, though, in Major League Baseball is they're throwing what we call a Major League changeup or a hard changeup, which is only 2, 3, 4 miles per hour different than the 100-mile-per-hour fastball. So now we're seeing players coming in the professional ranks that are throwing a hard changeup, and they're tearing the ligament doing that. It's all, again, associated with the need for velocity.
What goes through your mind, Dr. Andrews, when you hear a pitcher, a fairly established pitcher, say, I'm working on a new pitch. I want to add a new pitch to my arsenal. I've gone to whatever Driveline, whatever it is in the off season, and yeah, I was thinking of Spencer Strider throwing a curve. What goes through your mind when you hear that, though? When you've got somebody, quote unquote, working on a new pitch?
They need to have a sit down and deep talking to, and their parents need to be talked to too. But let me tell you what, that's like butting your head against the wall to try to talk them out of what their ideas are.
Mm-hmm.
But the worst thing that happens when they come in and tell me that their pitching coach and they just got into college is working on changing their mechanics up. Now, what does that mean? If they had a good pitching coach, it might mean great, good thing. But who knows? But most of the time when they start trying to work on a separate pitch, that's more intensity, more workload, and it's associated with an injury. So to do that, you've got to really be careful how you do it. so that you are not increasing your injury rate. To me, that's a red flag. So I'd be careful with that.
Doc, how does Major League Baseball help this? You know, they've sort of limited rosters. You know, there's less pitchers on rosters, the mound visits.
Fewer minor league jobs available.
Absolutely. You said the pitch clock had nothing to do with that. I'll take your word for that. How does Major League Baseball help this? How do they keep from the stars of baseball hurting themselves?
Well, the big thing was that it's what we've done in youth baseball to try to prevent the injury, the root cause of these injuries that may not show themselves until later on in their careers. And the first thing we did was I was on the board of the Little League International, and we started the pitch count rules, and we did that based on pretty much what we all knew was going on. I set those pitch rules myself, and the way I did it is I called 20 of my peers that were involved in youth baseball, and I asked them about how many innings should you be able to or how many pitches could you pitch at different ages. And that's how we developed the pitch count rules for youth baseball. From there, it went on up. You know, we had some 25 youth organizations back in those days playing youth baseball. And from that, it gradually worked its way into where all of the different youth leagues had to adopt those pitch count rules just from pressure of injuries. And from that also, USA Baseball got involved, and I was on their board. And, you know, they're the governing body of all youth baseball. So they helped push it. But we still didn't have any help from Major League Baseball. And the way we got that resolved was we tried to tell Major League Baseball directly. I did. I was on the research committee and still am for Major League Baseball, that if they didn't get involved at the youth level with their research and education aspects, they wouldn't have anybody to draft out of high school that hadn't already had a Tommy John's procedure. So that got their attention. And we knew that if we could get Major League Baseball involved at the youth level, particularly with some of the stars of Major League Baseball pitchers, televised baseball games with them talking about controlling the pitch count for kids at home. If we could get them involved, maybe the parents would listen. So Major League Baseball stepped up, and this was 5 or 6 years ago, in what we call the Pitch Smart program. And that program adopted all of the pitch count rules that we now use in youth leagues, and also we got it passed in the National High School Athletic Association for high school baseball. And the problem is everybody's learned how to cheat and get around some of the rules, so that's a whole other problem. But Major League Baseball has finally really started figuring out how to keep the game safety and healthy and prevent all these injuries that they're now seeing. So my hat's off to our commissioner and to Major League Baseball. In fact, they've got a study going on right now of how to prevent injuries in professional baseball that we're all talking about. So my hat's off to them.
Dr. Andrews, why did it take so long for baseball to commission this study? Because it's something, you know, I've talked to managers about it, and it just seemed to me that it would have been something that should have been done a long time ago.
Good question. You know, when I say it's a good question, that means I'm not quite sure how to answer it. Baseball has such a tradition, and I think part of the thing is that they look back and say, well, in the old timer pitchers, they had a lot harder and more extensive workload. And they pitched 250, 300 innings in a year, and a lot of full games, 9-inning games, and this, that, and the other. So it was hard to change. It was hard to finally realize from a scientific standpoint what was really going on out there. Now there are enough statistics that the Major League Baseball powers to be understand what's happening. The only thing they don't understand is that they're pushing velocity and throw as hard as you can throw on every pitch. So hopefully things like you're doing today in this particular podcast will get their attention. And I think Major League Baseball, from a commissioner standpoint, they certainly understand that there's got to be some changes because the effect that it's having on baseball is monumental. Besides that, it's costing them a lot of money from the injury situation.
Yeah, comes back to that, doesn't it? Yeah. Dr. Andrews, listen, thanks for doing this. It's a real pleasure to talk to you. Enjoy your retirement. I'm sure you're still going to be active with this cause. And again, we really appreciate your time. Thanks so much.
Thank you so much. Great stuff.
Well, I'm not going to give up on it.
Good stuff. Thank you,
awesome.
sir.
Thank you, sir.
Thank y'all.